All right, let's move on to the Babinski test, the very next test on page 14. 3 studies, only one looking at a number of the reliability and validity measures. One was just, I guess, a reliability test between the examiners, ultimately with a score of 2. So evidence moderately is there to support its use. How does that vary, I guess, or compare, say, to the Hoffman's? Chad, you want to talk about that?
Yeah, I think the challenge with Babinski is that it is a very, very specific test. So a person typically has a fairly pronounced neurological disorder before you get the upgoing toe sign or a positive Babinski. And the other challenge is that it is tested in a number of different neurological conditions. So any upper motor neuron condition. So the challenge, though, even though it's specific, it's not necessarily specific for a single neurological disorder. So it's going to suffer because of that. Its sensitivity is so low that that's going to influence its positive likelihood ratio. But a test like that, if you get a positive upgoing toe sign or a positive Babinski, I think you have to look at that patient and realize there's something going on here because it's such a uncommon positive finding with that condition.
Mm-hmm. And then just beyond that, in that same chapter, it deals with Clonus. And at the time, it was given the utility score of a question mark, meaning that there were no studies to support it. So, this is something that we were pretty much all trained to test, and that brisk, compression of that ankle or the wrist, and looking for those pulses afterwards, and 2 or more or 3 or more indicated positive versus 2 are normal. Was there at the time really no evidence to suggest one way or the other? Was this just based on some type of empirical or clinical experience? Chad, you want to field that?
Sure, I'll take that. Yeah, at the time, Clonus had never been studied for its diagnostic accuracy, but it is something that was pervasive in the clinic, and I'm with you, I learned it as well. It has subsequently been studied, and it tends to be more of a sensitive measure that's not specific. And we all know that we'll get a positive Clonus from a number of different conditions, some neurological, some not. There can be a muscular related phenomenon that'll give you a positive Clonus. So at the time, and this shows you just how much the studies in diagnostic accuracy have escalated in the last 15 years, at the time, there were no studies that have looked at it.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.